Nearly 10 years has passed since the province declared a public health emergency for drug overdoses. Since that declaration, more than 15,000 people have died from unregulated drugs in BC. It's a devastating number, but there is a glimmer of hope. 2025 is projected to see a significant reduction in the overall number of deaths compared to previous years. New numbers show in the first 9 months of this year, 1,384 people have died from suspected drug poisoning. While there are still 3 months to go, it's still significantly lower than where we were at over the same 9-month period last year and the year before. Island Health also seen a similar downward trend in Victoria, Nanaimo, and Campbell River. While it's a positive trend, advocates and experts say there's more behind the numbers and more work to be done.
But we have to be careful to interpret that.
When the public health emergency was declared, the rate of death per 100,000 people in the province was at 20. Today, that number is still higher at around 32.
We are still in a deadly, devastating public health emergency.
Dr. Bernie Pauly with the Canadian Institute for Substance Use Research adds that while progress in harm reduction and advocacy has made an impact, there are still many areas of the province, particularly rural and remote areas, where services for drug users are lacking.
We have tools or services at our disposal, and we actually need them all to have a strong response. We need harm reduction. We need treatment, but it also needs to be fairly and evenly distributed across the province.
What's killing people? It's not decriminalization. It's not prescription programs. It's the unregulated toxic drug supply fueled by organized crime.
Harm reduction advocate Guy Felicella points to potential stabilization in the unregulated drug market that could be leading to fewer deaths. But he says street drugs continue to be deadly.
A lot of counterfeit drugs out on the street, a lot of counterfeit prescription drugs on the street. So here's the thing as well, is that we have to be really mindful, is that anything bought off the street can be fentanyl.
While the downward trend is a positive sign, there are still far too many people dying, more than 5 every day in September, a sign advocates say even more progress is needed in this public health crisis.